So if you do have a sore throat, an itchy throat, have a temperature, a bit of a cough, anything that you think might be like flu-like symptoms, please come up and step forward and have a test. It gives us good information and enables the health authorities to have a sense of just how this virus is still moving amongst us. Total tested across the state now has reached 243,128. 243,128 people. So that is quite a substantial number of people. The good news out of that 243,128 is that 240,093 have tested negative. So it is a very positive outcome compared to other parts of the world. It's remarkable. But again, it's a partnership with the community and obviously the state and federal government, and all the health people generally. So thank you very much. Of the 3,035 cases that we have identified here in New South Wales, 2,306 people have recovered. So that's very, very positive. 315 have not yet recovered, and I'll ask Dr. Chant to say a few words about that and just give more details on where those people are and how they're being managed. Sadly, there has been another death, and I'll ask Dr. Chant to talk about that. That person who passed away was actually in the Newmarch Anglican facility. So it's particularly sad that obviously this very virulent and dangerous virus is still amongst the community, but broadly, but also within Anglicare. Can I say on the issue of Newmarch and Anglicare, everybody is still working flat out. When this first came up, obviously there were a very large number of staff who were taken offline because of the necessity once that first person was identified. Well, at that stage we believed it was only one person. As the investigations continue, it may prove to be more than one person, but still it's an unknown at this point. But obviously a very large number of their staff were taken offline to facilitate the isolation requirements that we all are very aware of now. And as I said yesterday, it's been very challenging because normally those patients, I mean obviously aged care facilities are generally run by a non-government organisation. Some very well-managed organisations generally, and they provide the care and the love that is necessary for residents in aged care facilities. They're regulated by the federal government, and generally each resident would have their own GP. Some aged care facilities, when somebody doesn't have a GP, obviously get a GP to come in and look after them, but there have been no GPs entering this facility now for quite some time for obviously their concerns about the COVID-19 and the virility of this virus and the impact, I assume, on those GPs in their capacity to treat other patients in their practices. But what has been happening is that they have had some telehealth capacity, so they've certainly been still doing some things with some patients, but New South Wales Health has had to step in. Normally New South Wales Health manages our hospitals, of course, but New South Wales Health has been required by need to step in and support the aged care facilities, but so has the federal government. The federal government have had Aspen Medical, and I think Sonic were doing some pathology, and so they've had their own staff in there. But today I've actually spoken personally to the infectious diseases specialist from the local health district just to get frontline advice on what was going on. And I think it remains a very challenging situation because of this virus that is so infectious. In the broader community generally across the world, although we have remarkably managed to manage it quite well in Australia, very well actually compared to any other places. But talking to that infectious diseases specialist, I did talk to him about the challenges of when you have an aged care facility and have the large number of staff taken offline, and what he was indicating to me, and further confirmed with other discussions, that it does present some very challenging management issues inside there for Anglicare, but Anglicare have, I think, largely stepped up and worked with the federal government and the state government to try and ensure that they get staff from other sources. But I just want to make it clear to the community that it has been extremely challenging for Anglicare. They've had to, in fact, have, I think it's nearly 9 separate agencies providing health staff and staff generally into the facility. And that presents its own challenges. So as we're now moving to a point where I think the staff numbers are around about 25% now of the original Anglicare staff who would have had strong relationships with the residents, and still a lot of other agency staff coming in. But we're seeing now people coming back. The original staff, as I'm advised, are coming back into the facility, which is great because they're the ones who know the residents best. But in talking to that infectious diseases specialist, I asked him, is there any step that New South Wales Health could take now that may not have been taken anywhere else that might actually just add that extra layer of support? And what he has suggested, which has been accepted, I understand, by Anglicare now, and I've just spoken to Minister Colbeck and made sure that the federal government would be happy with this arrangement. But what will happen, never happened, as I understand it, at any aged care facility anywhere, is that there will now be a daily testing regime of every staff member walking into that facility. That obviously has its own challenges, but I'm asking the staff, and I'm asking, as New South Wales Health Minister, I'm asking all the staff just to be accepting, hopefully, of what is quite an uncomfortable test, but on a daily basis. I believe that most of these people who are going in there would have great love for the residents, and it seems to me that in talking to the infectious diseases specialist, that's a really good step that we could take. It might not have been possible in earlier circumstances, but I think we've reached a stage now where most of the staff will probably, hopefully, accept that arrangement. So, and of course, there's a regular testing anyway of all of the residents who are located within the facility. So I think hopefully that will make a difference. Also, the New South Wales Health again has stepped up to provide a specialist in infection control from the Clinical Excellence Commission. So that person will be regularly on site to just really to support the staff in the use of PPE or personal protective equipment. I think it's all very well it's not a good thing to be actually blaming people who are at the front line who are trying to do their best for the residents. So if we can find more constructive ways to give them that support, then as Health Minister here in New South Wales, I want to see it done. And so I've made it clear that if we can have the people from the Clinical Excellence Commission, which is a subset of New South Wales Health, who understand how to really effectively use PPE, personal protective equipment, and just go in and provide the support to the staff who are otherwise providing the support to the residents and the love for the residents, we can hopefully make a difference on that. Now, the final thing I'd just like to say is there was a story today, obviously. The Treasurer and I have had discussions with the real estate industry. Obviously, it's a challenging time for all of the people who are working in the real estate industry, but more broadly at the moment. And one of the issues that we've decided is that we'll work with the industry, particularly around auctions and open houses, to see what we can do to provide greater capacity for more people to come in and see properties, but to do it in a way that is responsible and careful, and particularly around the basic message of social distancing. So Dr. Chant and I will be looking during the week and working with the industry. There's been some preliminary discussions, but we'll be working with them to just look at what else we can do to allow more people in to, for example, see an auction property, but not necessarily, better ways of doing it, but not the old ways. So I know I've been at a property sometimes looking at an auction property and there might be 40 people in the house. Well, that's probably a thing of the past, at least while we have this particular very virulent virus amongst us. But we still can. We're seeing such good outcomes because the community is working so well together I think that it is time for us to look at some of these ways that we can open up the economy more, and certainly I'll be working with the Treasurer and, of course, Premier Berejiklian to look at that in a staged and careful way. So hopefully by next weekend we'll have some more guidelines and possibly some orders, changes in the orders to allow that to occur. Now I'm going to ask Dr. Chances to expand on a number of those issues, whatever she considers appropriate, but particularly around the patients that we have and the care that they're receiving, but any other issues as well. So Dr. Chant.
So can I also just express my gratitude to the public for coming forth for testing, and we need to see those testing numbers remain high to give us that assurance to identify cases early and block those transmission chains. So again, anyone with even the most minimal of symptoms, please come forward to testing. And services are available 24 hours a day across the state of New South Wales, so please go to our website and get that information. There are currently 106 COVID cases being treated by New South Wales Health, and this includes 14 people being treated in intensive care units, with 11 of those requiring ventilatory support, and about 3/4 of the cases are non-acute in out-of-hospital care. In relation to the death linked to the aged care Newmarch House, it was in a 76-year-old female with confirmed COVID infection who passed away at Nepean Hospital yesterday. There have been 2 new cases related to the Newmarch House. One of those was in someone who had been a close contact of a case and had been in isolation for a period of time. And as you're aware, we then watch for symptoms that emerge over that 14 days, and that person has subsequently developed symptoms and was subsequently tested. I'll leave it there and then take any questions.
How is the other case of Newmarch contracted?
That's currently under investigation. We look at both exposures within the facility and also exposures external to the facility, and we'll provide any updates on what we think is the likely source. So no residents at that facility, but obviously we're continuing to monitor closely. As the Minister indicated, we are continuing to test the residents in a regular fashion, looking for signs and symptoms. We have cohorting arrangements in place in the facility, and as the Minister indicated, we are putting a further infection control presence in the facility to support the supervision of staff and support them in donning, in particular donning and doffing the personal protective equipment.
Just on that new testing regime, isn't it, just the timing-wise, wouldn't they already be infectious if they're, isn't it too late? Like, how quickly are you getting these tests back if you're testing them daily?
So we can actually get this test back in the same day, and our tests are really sensitive. One of the actual issues we're grappling with is sometimes we're finding that when we test people for a long period of time, there's persistence of the virus. So what we're hoping to do is pick people up in that pre-symptomatic period at the earliest possible phase. It's one measure, additional measure. It provides an additional safeguard, but combined with all of the other measures, it's a very high level of protection that we can put in place. We will still do the contact tracing, so if there's cases in the facility, we will then exclude anyone who's designated in close contact. The staff are wearing PPE, we're monitoring for symptoms, and obviously the visitors to the facility are restricted. So there's a range of measures in place to ensure, reduce the risk to the lowest level possible.
Testing regime of staff only been put in place now?
I think it's never happened before, James, in the sense of any aged care facility anywhere. And I think it's certainly, as this virus has progressed through our community, one of the early problems was we had not enough reagents, not enough testing equipment. And right now, we're actually in a better space to be able to do that. We've actually made some announcements yesterday. You weren't here yesterday, but we announced some more access to specialised testing capacity. And so, I suppose it's a good convergence, an opportune convergence that we now have more available testing equipment. And it seems to me that as Health Minister here, what other steps could we take? Well, what the what the infectious diseases specialist on the ground, the New South Wales Health Infectious Diseases Specialist, is saying is that they have done everything short of this, and so if they have now got the capacity, if we have as a health system here in New South Wales, and maybe other states and territories couldn't quite do what we're doing, but so perhaps won't become the norm, but it's certainly worth having a go and seeing if it does make a difference. So that's why we're doing it. Sorry, Ashley first, and then yes.
Minister, we're 3 weeks down the track since you first announced it. So, and you're saying now you're having these conversations with infectious control. Are you confident that the government has thrown everything it possibly could at this from the very beginning? Are you comfortable with how you've landed on this?
I think, yeah, I am. But I mean, I'm relying on health advice, obviously, because I'm not a health practitioner. But talking to the frontline staff, the top of the top in terms of infectious diseases specialists, he is certainly saying that we are, and so is the federal government, and so is Anglicare in a sense. But it's been very challenging because obviously it had a huge number of people who were taken offline initially, which brought in a lot more from the federal government had to then get Aspen Medical, who then had to rely on a whole lot of agencies to bring people in. And it'd be like having somebody substitute for you who doesn't quite understand all of the aspects of it, because this is a new frontier in a sense, having so much intensity within this aged care facility. They've done a lot of work. I mean, I can't tell you how many discussions I've had with New South Wales Health about what they're doing to support what would normally be managed by GPs in a normal environment, that is the aged care facility. So I'm quite satisfied that they are doing everything they can. Having said that, it's just terrible because we're still seeing people who are apparently getting transmission. Is it transmission in the facility? That's one of the issues that has been raised with me. Is it transmission in the facility or is it transmission out? Because staff obviously have lives outside, just like all of us here at the moment, but all beautifully maintaining the 1.5 metre social distance. Is that actually happening outside with all of the staff? Well, we can only manage that to a certain extent, so to try and at least provide that layer that's never been done before, it's worth having a go.
So then you have full faith in Anglicare, and do you think the family should have full faith that Anglicare has managed this in the best possible way?
I think Anglicare have taken the advice of health staff and done what they can in terms of the health staff. My only debate with Anglicare was about communication. It was about the fact that the family members were outside saying they weren't. But, you know, Anglicare's view on that was that they had an arrangement through their original contracts with the residents that they had a particular designated person to talk to, and that was what the resident wanted. And by far the majority of the residents do have, as I understand it, full mental capacity. There are some who obviously don't, and those residents have a choice at any stage to be able to change those arrangements and say, well, I want you to talk to other people, as I understand it. As they have, if they want to, they could actually move out of the Newmarch facility as well. They could go and reside somewhere else if they wanted to. But I think most people, it's their home. I mean, if I were ill, I'd want to be in my home. And I think that's the challenge. Particularly as you get older, the stability of your own home is pretty important. So we can all look at it from our outside perspective, but there are perspectives inside that we need to understand as well, which are challenging to understand, but nevertheless.
You say those residents have tried to leave, but the family of this lady who died say that they tried on 3 occasions to get their mum and grandma out, and were told she was safer in there on 3 occasions a week before she died. Do you think that's reasonable?
I can't comment on individual cases. What I can say is that you know, if the law is the law in the sense of what they can and can't do. They can actually go, but they would be also taking advice from not only you say Anglicare, but also it could have been the physician saying, well, if you move, your mum might be in a position, mum or dad, whoever it might be, your grandparents, could be in a less supported situation internally, in the sense that people know where everything is, they feel supported in a particular residence. So I think it's difficult for me to make those comments. But having seen, for example, older people up close and personally who have dementia, sometimes they are far better off in a very structured and supported environment. It's one of the elements of dementia, I suppose. I can't comment on that. I just can't go any further than that on that one. Happy to take something else.
I appreciate that, Minister. But this lady's family say that she tested negative twice and was in her room. She didn't have the virus. They talked about wanting her to leave. and were assured that she should stay and that the best thing for her would be to stay.
Sorry, I really can't comment on individual cases. I can't. I'm the Minister for 8 million people. I cannot comment on that. But I can say that certainly the discussions I've had, I think the communication aspects could have been enhanced, let's say. But having said that, you know, I'm not, none of us are in the position of the operator of that aged care facility that have faced an unprecedented situation. So I think, can I just say, sorry Ashley, just say this, in talking to the very senior infectious diseases specialist this morning, he said to me, and I remember this very clearly, he said it's time for people to stop the blame game and to actually make sure that we are all focusing on the individuals as we are here as doctors. So that was his message to me, and I'm going to adhere to that. So, and I'm just going to say that I think that it's not appropriate for me to comment on those things. Sorry. Yeah, sure.
Move to a broader issue. I spoke to a very experienced epidemiologist this morning, one who advises government, and she suggested that in her view it was time to either move the sick people out of Newmarch House or the well people out of Newmarch House. One or the other needs to move because the chances are that there will continue to be...
Look, there's the one thing I've discovered in health as a health minister is that on the one hand there's an advisor here, on the other hand there's a different advisor. How about we use our proper advisor, which is Dr. Chan, to answer that question. Dr. Chan.
So all aspects are being considered in this case. So the infectious disease specialist is involved as part of a team every day considering what new information's emerged, what is the difference. So all of those issues are being considered. I'd be happy for that infectious disease, that epidemiologist you spoke to engage us with just discussing the risks and benefits because, you know, unfortunately as we go forward with COVID-19, we recognise that our response to aged care facilities is going to be a challenge for all of us, and in all circumstances we want to do what's best for the residents and the staff that go to work in aged care facilities every day. And I just want to extend my appreciation to the staff at aged care facilities as well and acknowledge their role. So I'd be happy to have those conversations off board. This isn't a one-size-fits-all, it's a balancing act. It's a balancing act of respecting the wishes of the residents. Each resident may be in a very different circumstance. There may be some that are in palliative care stages where they've got underlying, cancer and their life is life limited. And it's a question of what does that individual person want? And that's why at the heart of decision making, I really can't be stronger than saying it has to be about the care for the residents and their wishes. I'm very happy to dispute, but just to let you know that all of the issues such as cohorting, removal from the facility, removing clean people. But in terms of talking to the infectious disease specialist at the time, one of his comments was if the facility had have been decanted day one, then you would have...
That is New South Wales Health Authorities there providing a COVID-19 update. There has been another death at the Newmarch House aged care facility in Western Sydney. A 76-year-old resident of the facility dying in Nepean Hospital. There's also been an additional 2 cases at the facility. One was a close contact of a case who had been in isolation. The other is still under investigation. As of now, there will be a daily testing regime of any staff member who enters the facility in a bid to try and contain the outbreak. Overall, in New South Wales, an additional 4 cases in the last 24 hours.